categories. And we're looking at funds to cover losses from March 1 to December 30th. So that is the time period we're looking at covering losses. Let's see. So the application process, and on the allocation, let me go back to that. So within, so like the residential part, how we divided that up between provider, because each provider has what we call an allocation. Basically, it's the cap you can bill for. That was based on a recent 3-month period, December through February, prior to COVID having an impact. And we looked at dollar value of billings for that 3-month period. And so we prorated the 17.6 among the providers based on their billings. And we kept updating that as early as last week to make sure we got all the rebills and voids and stuff accounted for, our late billing, as much accounted for as we could. So we had up-to-date numbers for that previous time period. And we used the same process for rehabilitation and employment. We allocated individually, but then added them together. So it's based on your share of the employment billing for that 3-month period, our provider share of the rehabilitation billing for that 3-month period. So the application process. So we have the list of providers, how much they're eligible for. So we are sending communications out. And that's coming from provider relations at the regional office. You're going to get a letters if you're with your allocation and with the forms to apply. So if you provide those services but you don't provide very much, you may not receive an allocation amount, because we capped this. We set a minimum threshold of $500. If you didn't have a large enough amount of services to get at least $500, then we cut it off at that point, just to prioritize and not be doing a lot of administrative work and require a lot of administrative work from providers for small amounts. So you will be so it's not like you have to go to the website and apply. You will be contacted by the regional office. If you think you qualify and do not receive anything, by all means you can ask. But further down, we'll get to the specifics of who qualifies. So let me just go ahead and scroll down to that now. So down below here are some more specifics. Who is eligible? If you bill for ResHab, Group Home or ISL, T2016, Dehabilitation, the T2021HQ, with the SC or TG modifier, that's Dehabilitation, and then employment, those 4 codes with any modifier. So if you don't bill any of those codes, you did not show up on our allocation. So how to apply, we kind of discussed that a little bit. You will be contacted. Once again, if you think you should have received an allocation but you didn't, please contact us. We'll be happy to check and discuss it. So how much, and I kind of discussed that. So basically it was prorated. So if you billed $80,000 for that, and these are just sample numbers, these aren't real numbers. So if you billed $80,000 for that 3-month period, and total rehabilitation billing was $2 million, you were 4% of the total. So you'd be 4% of the $2.4 million, or $96,000 of your allocation. That's kind of a funny example, because what you qualify for is actually more than your billing. So it's probably not a good, but the math is there. That just shows you the math, but the example is probably not proportionate. So the eligible dates, kind of went through that before. It's for expenses incurred March 1 through December 30. December 30 is the cutoff date. So you need to have your applications into us before that. Let's see, we want to cover the SAM2 enrollment. So some of you, I will just address this. We're having the Office of Administration for the providers that only bill Medicaid. You're not set up in the SAM2, the statewide accounting system. So I have pulled all the vendor numbers for all the folks out of the Medicaid system, and Office of Administration is setting you up if you're not already set up. So if you are already a SAM2 vendor, if you're already receiving some GR payments and getting direct deposit, you will get this check by direct deposit. If they're setting you up brand new. They're going to set you up to receive a paper check. So I don't know yet who is which, but I'm hoping that maybe I can run some data out of the SAM2 system to find out who set up paper direct deposit. So I don't quite have that information yet. So just I don't know if Wanda, if you want to discuss what the regional office is going to do once a provider fills out the documents and submits it back.
Sure. So first, just to give you an idea, Gary had indicated that you would be receiving notification regarding your eligibility and the amount that you're eligible for. So we had 352 providers who are DAHAB, Employment Services, ISL, or Group Home. All communications have been sent. All but 3 were sent by end of business yesterday, and the final 3 were sent today. So you should have something. If you don't, then please contact your provider relations. You received a letter of notification. You received the forms applicable to the types of services you contract for and contact information to submit that information back to the regional office. We did also communicate with those providers who are not eligible because they did not meet the $500 threshold, just so you would know as a courtesy up front that how that impacted you, so you don't have to go searching for that information. There were not very many, there were only 8, but still we thought it worthy to reach out to those providers and let them know their status. So all letters have been disseminated. We've actually already received 3 DAHAB or employment service attestations. So really on the ball, excited about that. But our role when we receive it is simply double checking the documents that you submit to make sure that your fields are completed. So on the DAHAB employment service attestation, there's a statement. You identify your name, your position, and the agency you're with. So we just want to make sure that all of your blanks are filled out basically, and that it's filled out completely, and that you have it notified. We're not on that DAHAB employment service verifying or asking you to verify the amount that you're attesting to that you spent, okay? We've already had, like I said, 3 submitted. If you report that you had a loss of revenue of $45,000, that's great. We'll track it. What you will be approved for is the amount that you were communicated with that you were eligible for. Like Gary said, that % of your billing, which may be vastly different than what you report. We're still tracking what you report as a loss in the event that we have an opportunity at some future date to obtain additional funding. So we would already have the numbers to advocate for that. But we will be saving all the documentation that you send us for potential audit purposes. It's essential that you also maintain all of your documentation. We're going to help you by double checking and balancing to make sure the fields are clear, but we're not scrutinizing the expenses that you're accounting for to make sure that those are going to pass an audit. Okay, as Val said, when it comes to the residential side, where you do have to invoice us, I like how she said it, it's the smell test. Is on the surface, does everything that you list as an expense that you incurred look to be a reasonable expense that would be related to COVID? You know, season passes to the Cardinals, probably not COVID related. You know, just saying, throw that out there real fast. But that's our role, just to make sure that the T's are crossed and the I's are dotted so that you're all good in an audit. We have committed to a 5-day turnaround. That's a 5-day turnaround from completed documentation from you. So if you forget to have your documentation notarized, we'll communicate that back with you, and your 5 days will start when we receive the notarization back. If your receipts and statements don't add up to the amount you put on your invoice, we'll communicate that with you. Maybe you dropped off a receipt, it didn't come through in the scan, or maybe somebody accidentally inverted numbers on the invoice. You know, very easy, simple reasons that those could be mix-ups, and so we'll communicate that back to you. We want this to be a very quick process, which is why we committed to the 5-day turnaround. The day have employment services will be super easy and fast to process, just making sure the fields are filled out. We will send those up to Gary and Stacy at central office, who will do the final processing and get it into the system. And I think, Gary, we're hoping right from the time we send it up to be a 2 to 3 week turnaround. Isn't that right?
At the most. I think I said 2 to 3 week in this document. As kind of safe, depending on how we key them in, I expect it could be faster.
So we're really, really sensitive to the fact that you all need this funding, and that this funding is predetermined in amount that you are eligible for. We're also aware that for some of you, it might be challenging to gather those receipts. It might take some time. You might have to, for the residential side of things, you might have to invoice us 20 times to reach the amount you're eligible for, and we're prepared for that. I know we've already received some questions about invoicing and if providers could continue invoicing us for costs incurred after their notification, meaning if you were notified yesterday, is that the cutoff for the cost that you could track and report for reimbursement? And it is not. As Gary said, this is for eligible expenses through December 30th. So if you wind up purchasing electronic equipment or technical equipment, let's, for example, say next month, to assist with community networking or remaining connected to people's families because they can't due to COVID and they don't currently have those resources, that's an expense you could invoice us for next month. So, so we are expecting, multiple communications from some of you and maybe, 10, 20 invoices to get to that amount because you're going to continue to incur expenses through the end of the year. So that's kind of a quick and dirty on how we're going to process it. There's really not much to our end other than just cross-checking and balancing what you're submitting. So the forms, if you have questions, if you look at those forms and you hover over fields, you'll notice that most of them have built-in instructions or further explanation as to what that field might mean. So that could help you as well. But if you have any questions about what you're seeing, please contact PR and they'll walk you through some of those things. One of the things that we wanted to point out, you'll see it in the documentation and explicitly says that this does not prevent you from applying for other sources of aid. So we've also gotten questions from providers who are dually enrolled with DHSS because DHSS has their own grant for their providers. So if you are dually contract for state plan and us, you may be eligible for both. That said, you probably want to make sure that you're invoicing the right entity for the right expenses. That might get a little tricky, but there are other sources of funding, and especially for those providers who were not eligible for us due to the amount of their distribution, they could be eligible for another funding source. So, Gary, I think that was all I had.
Okay. I'll see what we'll pull up the forms here a little bit and go through them. So if I'm missing anything, feel free to jump in. So I wanted to, and somebody asked me, emailed me a good question this morning, so maybe I need to clarify. So the residential and the day employment are two separate amounts, and you apply for them separately. So there's an attestation form for residential and an invoice spreadsheet for residential, and that invoice is where you itemize your things and you supply receipts along with it. That's for your residential allocation. If you also do day or employment services, you're going to have an allocation in that category as well. You fill out the attestation for the day and employment services separately, and then you're just paid that full allocation amount. Even though there's on the form where you fill in what your expenses were, we're treating that as a grant and granting the total amount. So you do apply for them separately. One can't fill a gap on the other. They're two separate amounts. So with that, let me look at my notes. So for central office, Wanda said they're committed to getting up here in 5 days. our job here is only going to be to key it in and get it through and processed. We were thinking about using the Seymour system, which might add a few days to it since it only sends to our accounting batches to our accounting system. We're going to try to do weekly. If we're able to key these directly into the statewide accounting system, then payment will be quicker. But our job here is only going to be to track how much of your allocation you have and just get the payment key. So with that, let me go down and open. I can open this. So basically, you're going to just fill out information up above, an NPI number. If you have a main one, I don't know if that's be a specific one, as long as it's yours. And then it's just pretty much you fill in the blanks until you get down to here. There's instructions about how to invoice for your expenditures and what to attach. Then there's this attestation down below here. So section 8.315 of House Bill 2008, that is the House bill in the budget book where the actual grant funds are coming from. So that's what that line means. And then we mentioned the amount. And then here's all the attestations that what you agree to, what you certify. And let's see, down below, I'm going through this really quick because I don't really want to sit here and read this whole thing to you. And Wanda, stop me if there's something on here I should note. So when it just says like we have the right to audit this, it's subject to verification, and that these aren't expenditures covered by other sources. And then all the way down below is your signature, title, and date. A notary public. This has to be notarized, and then accepted by will be when we get up, if everything's completed and I get it from PR, this will be my signature on the bottom, and then we'll process payment. Okay. Go back. Rehabilitation, very similar. One thing I'll point out is it says right here, the provider attests that the business interruptions resulted in, blank of dollars of lost anticipated revenue, and that so many dollars has not been recovered. We're tracking this, but this is not going to determine what your payment is going to be, your allocation amount, but we are still tracking this. And so just same thing, this is coming from section 8.315 of House Bill 2008 is the authority. And then all the attestations, what you agree to, and then the same notarization, and then I'll sign it at the bottom. See, then the invoice, what the invoice looks like. This is kind of what I wanted to get to. And this, now let's see, it's going to be complicated. All right. Wanda, do you see the invoice?
Yes, I do.
Okay, great. It opened up in a different screen. So this is a template that we got. This is similar to, I think, what was done on the social services side for long-term care facilities when they got their grant expenditures. So personnel, this is basically a schedule. And I don't know, Wanda, do you have any specific things they're looking for if they submit personnel costs?
Some of the things we've talked about, obviously you could be incurring overtime, you could be incurring hazard pay, administrative pay for staff being off because they're quarantined, or covering pay to retain staff while you're closed. You might also, be subcontracting with some entities, unfortunately, due to, to shortage of DSPs. So those would all be logical expenses here, but that's not an exhaustive list. You might come up with things we just haven't thought of yet.
Okay. So would there be documentation attached for the top part?
There's supposed to be documentation attached for all expenditures.
All expenditures, okay, even personnel, okay. And Fringe,
To clarify, Gary, 'cause since
huh?
you said that, I did ask the question because I anticipate this might happen, but handwritten receipts or invoicing because a receipt has been lost is not an accessible documentation.
Okay.
So with today's electronic system, if you've lost something, you should be able to backtrack it somehow. So I want to throw that out there since we're talking invoices.
Okay. There's a section after Fringe and a section for travel, then equipment. And I think we had been asked earlier about, equipment for telehealth. Yes, that's definitely covered. Anything related that you had to do. Supplies, any contracts that you entered into. And what some examples would be, maybe, I don't know if you had to do additional nursing or contracts for any type of services, um, any type of staffing, something like that, or cleaning. Maybe it could be cleaning and disinfecting as well, any type of contract like that. And then total. And so it says insert additional rows above here if needed. So you can go right here and, in Excel and do the insert, and keep adding rows as long as your total. I assume PR is going to make sure the totals are summing the entire column. So just be careful where you insert new rows so you don't mess up the formula. But I assume we'll be checking that as well. So that is the form. Let's see, go back to.
Hey, Gary, do you want to, before you exit out of that, those details translate over to the summary on the first tab? Do you want to show that?
Oh, sorry, you're right. Okay, this is where you would put your name on it. An invoice number, like I said, you can do multiples of these. So if you have some documentation now that you want to send in and you're still maybe accumulating personnel stuff, you can do that. So yeah, like Wanda said, you can send in multiple, and then the totals are going to pull over to here. So like if you're inserting new rows, make sure your formulas are still working. So down below, and then there's the authorized signature. And this, I assume, does not have to be notarized, just the attestations. So I will take this time to point out that we've had a lot of interest. Yeah, we had some concerns that shared living was not included. So what we're going to ask, if shared living providers want to fill this out to document what they've experienced, we will hang on to these. In the event that we get approval, like if not all the money's claimed, or if there is additional money available, if there's any way we can work it out and get approval to do so, we may expand this to shared living as well. So, but that is a maybe. We don't have approval to do shared living at this point. So if you want to send in documentation, that may help us in the future if there's some additional money to make the request. Okay. So with that, let me look at my notes. I think I've covered everything I want to. I know there's a question about, are Senate Bill 40 boards eligible? If they're a waiver provider, yes. If they do one of these three services, they're in the same group with other Medicaid waiver providers. State-operated waiver providers, of course, are not eligible.
Gary, I think we have one question in the Q&A box.
Okay.
From Mark Keeley, is it correct you want us to bill everything, even if it is in excess of our allocation, so you can track true costs?
Yes, that is correct. If you want to do that, then we will keep tracking costs. Our little hope and dream is that there may be money available as we get closer to December. And so if we have some data, we can make a pitch for it. That is the reason.
And we have another question. We are an employment service provider and receive funding through the SBA PPP funding. and EDIL loan. We also receive funding from a private grant to help offset losses from COVID-19. Does the receipt of those funds make us ineligible for these funds?
It does not make you ineligible. However, you need to deduct off, if you're looking at your total cost of what COVID was, you need to deduct those other ones, those costs off. This is for, these grant funds are for unreimbursed costs. That being said, if you're an employment provider, you're getting the grant amount, so it's not being adjusted. So I would say so that may be confusing, but if you still have unreimbursed costs that those other things didn't cover, yes, still apply and you'll get the grant amount.
And that's something that if you were getting funds and support from multiple sources, such as this example, you'll want to be able to keep that information and show that information in the event you were audited, to show that you didn't receive funding from 3 different entities and every single one of those 3 covered your expenses. So that's an internal thing you'll keep. That's not something we're going to check for with your submission.
And so there's a question about do they have programs have to deduct other funds? The attestation, and let's go back to the attestation. See if we can find it. I think this is federal funds requirements. Let's see. I'm looking for if they have unreimbursed funds. Let me go back up to the top. And so in that blank dollars, I'm looking at the last sentence of paragraph number 2, has not been recovered from any local, state, federal, or private source. So if you have some unreimbursed costs, as I read that, and maybe we need to get more clarification, but I think as we all interpreted that, as long as you have some unreimbursed costs, you can apply for the grant. And I don't hear anyone contradicting me, so. Okay. We can give it a minute for a few other questions. Anything else, Wendy, you think we need to cover? You think we covered it?
Yeah, no, I think you covered it. And if there's no questions on this topic, I'm just going to ask since we've got some time left in the hour, there's a couple things. I'm just going to open it up to any general questions that we might be able to answer, or at least chase down the answers to. Please feel free to put those questions into the chat box. And then I also want to pick your brains about some topics for these Tuesday calls. And we've got a list that we have started. Heike is going to pull that up for me and just show you some of the ideas that we have come up with, and would like to hear some other ideas from the group if you've got that. The goal here is, today was a little different because this grant has just come out and we really wanted to get information out and make sure we had the opportunity to talk about this as much as possible, that we made today's really focus on this grant application. But going forward, we really want these calls to be very inclusive. It's not a focus on the division and us doing training or presentations or anything. It's really about conversation with our network, whether it be our TCM providers or our service providers, and what topics can we talk about that would help us maybe either problem solve or come up with some ideas, get innovative. It would be ideal if on these topics that we're able to pull together a panel that has different types of people that can offer different perspectives on the topic. Like when we're down there talking about technology, we broke it out and talked about smart home technology in place of staffing and how to use that in place of staffing, and remote services and support to reduce in-person staffing. Our providers, we know, are really struggling with recruitment and retention of staff, and so anything that we can do to help alleviate some of that burden and that stress and still be safe and productive and meet our end goal of creating more independence for a person, the better off everybody is. And then we've talked a little bit in a previous session about how to use remote supports to actually deliver a service. We talked about that early on. I think it would be interesting to revisit that after people have had some more time with it and maybe come up with some other opportunities and ideas and what they've done, and then how to just build that social capital using remote technology, avoiding isolation, how to maintain friendships and stay connected with family, or how to get more engaged in interest groups or other things that are going on there through social media, and how to do that safely. So if we just look at technology for an example, we can look at all of those areas, and we could invite a guest to come on that has expertise in there. We can invite a provider to speak about the service that they provide with the use of the remote service or the technology service. We could invite an individual and a family member to talk about it. So we could really make it a panel that is a conversation about it, and open it up to those on the phone to ask questions. And how did you get over this? What were some of the hurdles, and how did you get over the fear of not having staff just there in case something happened, and just that kind of stuff. So keep that in mind as you're thinking about topics. We want it to be something that can be inclusive of a group of people that can bring a different perspective to the conversation. So, but it doesn't have to be limited to just that either. So it's just whatever is going to make sense for us. So, Heike, if you'll just kind of scroll. I know managing social isolation is a big thing that is being talked about a lot, not just in our field, but all over for everybody in everyday life. Social isolation can lead to a lot of problems, mental health problems, depression, and just being withdrawn. And so how do we avoid that? And keeping things interesting during quarantine and isolation was another idea that was thrown out there. So what are some innovative things that folks have done? I know we've done a lot. We've had providers do a lot with social media and different things. So Heike, if you can scroll down from technology. Heike, are you there? We have some other ideas down there. I don't know if she can type on that actually while we're doing it. I see an idea coming in there. I don't know what happened to Heike. So I see a couple people have put in.
I'm here, but I can't type on the document at the moment because I'm actually just sharing the document, not my screen.
Okay. Can you scroll down on the document?
I am at the bottom according to my screen. I have employment and apprenticeships, modified staff training.
That part. We can't see anything below technology.
Oh, well, it's scrolling on my screen. I have no idea why it's not doing that on your side. I'm sorry.
Would you like
do you want me
to call and see if I could share?
Do you have the document, Wanda?
Here, I've got it pulled up. Let me see if I can share. I might be able to wing this. This is not my skill set, everyone, so.
Yeah, I'm happy to transfer to you, Wendy, if you'd like to share that.
Okay. So I see Corey has suggested in their medication support. So yeah, we can add that with technology. I think, is that what you're referring to, Corey, is how to use technology?
Oh, someone chimes in, Wendy, and says that they can see the whole document, so I'm not sure.
Really? Well, maybe it's just me, and maybe I'll screw it up now by sharing.
That's all right.
You may have it zoomed, Wendy. I have to zoom out to see it all.
All right.
Were you guys able to see it all?
Yes, if I zoomed out.
Okay, now can you see it too?
We see your email.
I see your email.
Oh, poop. Don't look at my
Do you want me to-
email unless you're going to answer it. Okay, now can you see it?
Yes.
Okay. So we talked about technology. I'm going to add in here medication support. I don't know what happened to that screen. So now I can't see the WebEx to see what anybody comments or chat is, so you guys are going to have to help me with that. All I can see is Wanda. Okay, so I'm going to put medication support. Is there any other ideas that have popped up there? Can you guys still hear me?
I hear you, Wendy.
Yep, hear you.
Okay. I can't see anything except the picture, so I don't know what happened to that. But is there anything else popping up in the chat? I'm going to need you guys to chime in and facilitate that. Is there anything in the chat?
I don't see anything new.
Okay. Need some ideas. I also reached out to Rachel Jones, and she is interested in doing a session on just self-care. She hosts the Missouri Cares calls weekly. I think they're weekly for an hour, and it's just a really nice way to help people kind of learn new tips and tricks about how to manage anxiety and stress and how to relax, and how important it is to take some time for yourself and to take care of self-care. So she's going to join us. Any other ideas? Apprenticeships. Dwayne is working with, and Heike are working with some partners in higher ed to offer up some apprenticeship programs that might be a really good alternative to helping us build some expertise in our field. So we want to talk more about that. Anything else you guys want to hear more about? Are there any other questions on other topics that All right, we're not getting anything else in the chat. Real quiet group this afternoon. All right, well, if there's nothing else that people have that they want to bring up or share, that's fine. We can give everybody some 15 minutes back in their day. And if you think of anything, please don't hesitate to either email me or send it to DD Mail, and we will get it added to our list. Thanks, Gary and Wanda. And thanks, everybody, for joining.